And we want to thank, as you mentioned at award, many thanks to Ruth Berlin for walking us through this whole program and the whole IPM group in the state of Maryland. Today, I'm going to talk a little bit about how we manage bed bugs at Luminous Health Anne Arundel Medical Center next. We know what bed bugs are. They're reddish brown, wingless, slightly larger than the head of a pin. You normally find them close up to the head of patients if they do come in here. And they really don't spread diseases, but they're an environmental issue more so than anything else. Next, please. As I go through my slides, I want to emphasize a lot that the most important part of any program we have in EBS is working with our nursing peers. It is critical that we work with them and we work hand in hand because they are the ones that will identify most of the issues initially. So our nursing staff here, they're well trained to look for bed bugs whenever there is any sign of bites or any sort of that stuff on patients as they come into the building. So if they suspect bed bugs and there are no bites or anything found on the patient, they continue to inspect the patient and monitor that patient. If there are bugs found, one of the first things they will do would be to collect the patient belongings and contact social work to make sure that there is a plan for whenever the patient leaves our facility if there's bed bug on that patient. They would normally notify us immediately if they can't identify the bug. And so, normally about 4 years ago, any bug was a bed bug in the eyes of the nursing staff. It could have been lice, it could have been anything, but now they're much more trained and they have pictures in the area so they can look at a specimen and identify it. Next, please. We place the patient in what we call contact isolation for the duration of the patient's stay. Real important is that we remove all the clothing that the patient come into the facility with. If there is anything that's on that clothing, we want to bag it. We want to have the patient have a bath and give them fresh clothing, patient gown to be in at our facility. We seal that bag properly and we try to get it out to the patient to go home. If not, we give them options that they can use to eradicate any bed, if there are any bed bugs in their clothing. Social work, care management, they're acutely involved with us because if the patient have to return to an area that is infested with bed bugs, it's not good for that patient. So we want to make sure when they leave our facility, they go to a home or a place that's free of any type of infestation. So we follow the patient from the time we get them all the way through. We just don't let them walk out our front door and they walk back into a similar type issue. Upon discharge, ABS then takes over the room. We gather all the linens, everything from the room, we bag, seal, nothing is taken out of the room. Next slide, please. We treat the room. So we use the isopropyl alcohol, 70%, and we treat every area of the room around the edges, corners, around the seams of the mattresses, and we leave the room shut for approximately 48 hours. We do also do re-investigation in that period of time. So it's important that we get all the reusable items, sprayed, anything that is in the room, stuff that we can discard of, we discard of it. So there may be a reusable pillow. It's not a very expensive item. So we will discard of stuff like that. We can't discard of a mattress. That's a very expensive stuff. So we want to make sure that we treat it properly. So if there is any bed bugs in the area, we use the isopropyl alcohol because bed bugs have an exoskeleton. It's able to break the exoskeleton down and kill the bed bug. Our supervisors are trained to do this. We go through and they all can do this. We do not let our employees do it. We have supervisors on 24/7, so they will respond to those calls. Those calls are very far and few. We don't do a lot of those calls normally. Next. Again, as I said, we close the room for a maximum of 48 hours, but after the first 24 hours, we want to walk back into the room. We want to inspect it. We go through the entire area. and check to see if there are any bed bugs in the room or any type of bugs whatsoever. One of the things we did at probably about 5 years ago, we had a really high number of bed bug incidents in the facility. So it takes a room out of service for an extended period of time, and the treatment then was a little bit prolonged. So we developed our treatment process based on everything that you read in literature. We also used a very reputable company that worked for us to validate what we were doing. So we had a bed bug dog come into our facility after we finished the treatment and went through the area to see if there was anything left in the area. And on both occasions, there was nothing left. There was no signs of bed bugs at all. And the areas that we did treat wasn't pretty highly infested because there was a lot that came in with the patient. In non-inpatient area like the ER, the OR, or procedural area, we don't normally shut it for 48 hours because it's very, very quickly identified. So whenever we can turn those rooms over, we turn it over. But first, we got to make sure that they're free of any type of insects, bed bugs, anything at all. Next, please. The key to whatever we do here, and I really want to emphasize this, is really our nursing partners, because they're the one that's accepting that patient. They're the ones that's doing that initial assessment of the patient, and they're the ones who will observe anything on the patient. So we work extremely closely to our nursing partners. I can't stress that enough, how critical nursing is to what we do in AVS. Thank you for the opportunity.
Thanks so much for watching our expert on IPM. I'm Sean Lynch, the director of the IPM and Healthcare Facilities Project at the Maryland Pesticide Education Network. We hope this has inspired you to consider new steps you can take to make your facility safer for your patients and staff. Please reach out to me at email at sean@mdpestnet.org if you have any questions regarding implementing IPM at your facility. To learn more, please visit the project at mdpestnet.org. Choose projects and then the IPM and Healthcare Facilities Project.